Based on the website patient.info, it is exceedingly unlikely that a patient may die while under anesthesia in the operating room. For every 100,000 general anesthetics administered to a healthy person undergoing scheduled surgery, approximately 1 person dies. To put this into context, Wembley Stadium, which holds 90,000 people, is the largest stadium in the United Kingdom. If we administered general anesthesia to everyone in the stadium, it is possible that 1 person would die. However, these statistics do not reflect the true picture. Although it is not always the case, it is highly likely that 1 person who dies has a complicated medical history or is undergoing a difficult surgical procedure. In the world of medicine, performing surgery can be a critical point in determining whether the patient will live to tell their family about their heart-wrenching experience in the operating room, or whether the patient will end up in the morgue, waiting for another doctor to diagnose the mistakes that caused the fatalities by other amateur doctors. Then, how do we reduce the risk? The evolution of medicine has been revolutionary and unprecedented, with the introduction of new drugs and techniques, as well as the development of new surgical operations. Seeing how health and science have evolved to adapt these new approaches and overcome life-threatening surgeries with the use of modern medicine and advanced robotics is amazing to witness. Although anesthesia was first used in the operating room in 1846, the use of anesthetics has proven to be a critical standard operating practice in the operating room since then. Though its study and development has had a generational impact, as better and more efficient medicine is being used in hospitals regularly, it is still being continually studied and developed. Then, what drugs define as anesthetics? Anesthesia is a medical term that refers to a medication that prevents patients from feeling any discomfort while they undergo surgical procedures. Scientists have developed an anesthetic drug library that has a range of different effects on patients. The types of anesthesia include general, regional, sedation or monitored care, and local anesthesia. General anesthetics are used to put patients to sleep while they are undergoing surgery. With regional anesthesia, it is injected near a nerve or the spinal cord to block pain signals from reaching the brain. Sedation, also known as monitored anesthesia care or twilight sedation, is often used for minor surgeries or shorter, less difficult procedures. Local anesthesia, also known as local anesthetic, is a type of drug that numbs a small area of the body and is usually administered as a one-time injection. Some complications that may come up during an anesthetic space are pain, nausea and vomiting, damage to teeth, sore throat and laryngeal damage, anaphylaxis to anesthetic agents, cardiovascular collapse, respiratory depression, aspiration pneumonitis, hypothermia, hypoxic brain damage, nerve injury, awareness during anesthesia, embolism, backache, headache, idiosyncratic reactions, iatrogenics, and death. According to an interview with a local clinical specialist and lecturer at the Department of Anesthesiology and Intensive Care of Universiti Teknologi MARA, UiTM, 38-year-old Dr. Fauzia Ahmad said that anesthesia is the most significant procedure to have ever been invented.
Anesthetics, a lot of challenges lah. I said, we not just the work during the surgery itself. Actually, we already start the work before the surgery. As I said before, we must make sure the patient fit or not, well prepared or not. So, throughout the surgery, we have to monitor the patient vital signs such as breathing, his blood pressure, his heart rate throughout the surgery. Even we have to record every 5 minutes. So it's not even every 10 minutes. So the monitor have to be done continuously. We have to put the data every 5 minutes inside our anesthetic form. And most of the patients require some advanced breathing. Like I said, depends on the machine, the anesthetic machine. So anything can happen throughout the surgery. The machine can be default. Alright, patient might have reaction during the surgery. So therefore, throughout the surgery, these have to be there. So to ensure the safe anesthetic and safe surgery patient.
In conclusion, anesthetists are one of the most important people to be present in an operation room. Despite being widely underappreciated, they still carry out their responsibilities to make sure the patient is safe all throughout the procedures. Anesthesia, despite being discovered hundreds of years ago, can still be fostered for more accurate results.